The findings of this new study on obstructive sleep apnea, OSA, are not merely concerning. They demand urgent attention. While sleep apnea is often dismissed as a nuisance or a source of daytime fatigue, mounting evidence now reveals that its effects may extend far deeper, directly threatening brain health and hastening cognitive decline. The study, published in Neurology, indicates that individuals experiencing low blood oxygen levels during REM sleep are showing physical signs of damage to critical memory centers in the brain, namely the hippocampus and the entorhinal cortex. These areas are foundational for memory formation and retrieval, and their degradation is a recognized hallmark of Alzheimer's disease. The presence of white matter hyperintensities, often considered early signs of small vessel disease in the brain, was directly correlated with reduced volume and thickness in these memory-related areas. This damage is not subtle, and it's not speculative. It's visible on brain scans and has measurable cognitive consequences. The fact that this degeneration appears to be associated with drops in oxygen saturation during REM sleep is especially alarming. REM sleep is essential for memory consolidation, emotional regulation, and overall neurological resilience. During REM, the brain is especially active, and disruption of this phase due to airway obstruction undermines some of the most crucial restorative processes of sleep. Yet, in obstructive sleep apnea, individuals may dip below 90% blood oxygen saturation repeatedly throughout the night, a threshold that in medical terms already qualifies as hypoxia. It is not a benign state. Over time, this intermittent oxygen deprivation appears to be injuring the smallest and most vulnerable blood vessels in the brain, slowly degrading the white matter that facilitates communication between different brain regions. This is not only a problem for those already experiencing memory problems or older adults. It is a silent, progressive assault on brain structure and function that may begin years before symptoms become noticeable. One particularly worrying aspect of the study is the implication that this damage is ongoing and may not be easily reversible. While it's true that the study shows correlation rather than definitive causation, the strength of the associations and the biological plausibility of the mechanisms should set off alarms in both the medical community and the general public. When drops in blood oxygen during REM sleep predict both physical damage to brain tissue and poor performance on memory tasks, it's difficult to dismiss this as incidental. These aren't abstract findings. They reflect a concrete path toward long-term neurodegeneration. Even among the study's participants, who were not clinically diagnosed with cognitive impairments and were not taking sleep medications, the damage was evident. This suggests that even mild or unrecognized cases of OSA could have significant neurological consequences, especially if untreated for years. And yet, obstructive sleep apnea remains one of the most underdiagnosed and undertreated conditions in older adults. Many individuals live for decades with undiagnosed OSA, chalking up their fatigue to aging or stress. Sleep studies are often delayed or denied by insurance. Even when diagnosed, many patients struggle with adherence to CPAP therapy or are not properly followed up by physicians. The result is a silent epidemic of hypoxic brain damage occurring night after night in millions of people, damage that, by the time symptoms emerge, may be irreversible. What makes this even more tragic is that OSA is treatable. Continuous positive airway pressure, CPAP, therapy has been shown to reduce the number of apneic events, maintain oxygen saturation, and improve sleep quality. But without early identification and consistent treatment, the damage accumulates slowly and insidiously. The implications of this study also intersect with broader concerns about Alzheimer's disease and dementia. If untreated sleep apnea contributes to or accelerates the degeneration of memory-critical areas of the brain, it could be one of the most modifiable risk factors for cognitive decline in aging populations. Unfortunately, very few dementia prevention efforts currently focus on sleep health, and even fewer include sleep apnea screening as a standard part of elder care. This needs to change. The entorhinal cortex and hippocampus do not regenerate easily. Damage to these areas rarely heals. Prevention is the only real option, and it begins with recognizing that poor sleep particularly in the form of undiagnosed OSA, may be one of the earliest and most preventable drivers of age-related cognitive dysfunction. The study also has limitations that must not be ignored, including a small sample size and lack of diversity among participants. It focused mostly on white and Asian individuals with an average age of 73, meaning the results may not be generalizable to younger populations or other racial and ethnic groups. That said, the consistency of these findings with prior research on the links between hypoxia, vascular damage, and cognitive impairment gives weight to the conclusions. Further studies with larger and more diverse populations are necessary, but the existing evidence is already strong enough to warrant aggressive clinical action. Ultimately, this research is not simply about sleep quality, it is about brain preservation. If we fail to act on this knowledge, we are inviting a wave of avoidable neurological decline across an aging population. The silent destruction caused by obstructive sleep apnea during REM sleep is not merely a risk factor. It is a public health emergency in slow motion. Ignoring it means allowing millions to slip gradually into cognitive decline when the tools to intervene are already within reach.